And now I'd like to introduce Marcia Miller. Marcia was the CEO of NWRPCA from 1996 to 2004. She was the former CEO of the Ohio Primary Care Association. I had that wrong in my memory book. Long history in workforce programming, including direct service, finding job placements for the unemployed, developing a retraining program for returning women veterans, serving as a women's employment policy advisor to Ohio's governor, as well as creating and implementing recruitment and retention strategies for community health centers. Currently, Marcia works as a consultant in Denver, Colorado. Marcia, thanks for making the trip out here, and we're looking forward to your reflections.
Greetings. First, I'd like to give my congratulations to Barb and Bruce, the board, all the members and the staff of the Regional Association on our 25th anniversary birthday. And then I'd like to talk a little bit about connections. The Regional Association was born because the health centers, after some lobbying by Alice and Maria, realized that being connected was better than not being connected. I like to think that I enhanced that strategy during my time at the association and that organizational value by facilitating some new and expanded connections. I'd like to highlight a couple of them. My first day on the job happened to be the annual strategic planning retreat, so that was kind of interesting. And one of the things the board told me at that time was they wanted me to work with the state PCAs to bring that, to bring us, the 5 PCAs in the region, closer together and to help clarify our roles again. That's been an ongoing process throughout the years of the Regional Association. And as other people have said, it's really been a great benefit, I think, to the health centers in the Northwest. The only other active regional association in the country is in Region 8, as you probably all know. So what we did is we began having monthly calls to plan and share and problem solve amongst ourselves. We had annual planning retreats, which later included the state PCOs as well. And we began to schedule PCA learning and sharing sessions during every conference. And of course, we played together. We became really good friends, which we still are. Even Marilyn's the only one left from the original PCA directors from when I was here. As I can see it, it became a very high-performing team that was better able to serve the health centers. And that high-performing team continues today, although with new executives. I worked really hard with a lot of others to bring together the PCAs, PCOs, and field office staff in Regions 9 and 10 to grow the STREAM team. That was the purpose of the STREAM team, was to increase the focus on services to migrant and seasonal farm workers at the state and federal level, as well as the public policy issues that were important to both the farm workers as well as the centers that served them. And that lasted for several years, and then the states began to be able to do a lot more of that work by themselves, and the STREAM team sort of went by the wayside. But I sort of think of it as an incubator, and I think there's a lot more ability now at the different state levels to be working on the farm worker issues. So that was a really important thing to me personally. And then, of course, there's the now famous Region 18 collaboration, which continues today, and that was sort of born and raised during my time at the association as well. So we're really smart about staying connected in the world of work. It's a proven tool of success. But what about in our personal lives? When I was going through my files, talking to the staff a couple months ago while they were developing that nice book on your table of the history of the organization, It was a walk down memory lane for me as well. But one of the things I found was the notes from the last time, my notes from the last time I spoke to you, which was 4 years ago at this conference, at this luncheon. And one of the things I said at that time was I asked you to take care of yourselves, because caregivers often forget to take care of ourselves. And rather than reminisce anymore, I'd like to kind of pick up on that for a few minutes where I left off 4 years ago. We get so focused on work and family and community, looking out, that we forget to look in. I want to remind you that you all have within you all of the information, the truth, and the wisdom that you need to have a healthy, happy, and successful life. And you can feel it in your body. You know, those old sayings about gut feelings is based on the truth. So let's try it for a minute. Close your eyes and check in with your gut feeling. And see if your gut isn't telling you, ooh, that feels like the truth. We all know that the best healers are not just those who are following the latest clinical guidelines, but also those who follow their gut feelings. So I'm asking you to stay connected to your gut, to your inner wisdom and truth, and also to trust it. Don't override your feelings. How often do we say, this doesn't feel quite right, but then we should on ourselves, and we say, oh, I shouldn't feel like that, or oh, I should do it this way. Trust your gut. Stay connected to yourself, to your highest self, to your inner wisdom and your inner truth. And lastly, did you know that we are all connected to each other? You can call it the universal life force or the higher energy or spirit. All the spiritual traditions have been telling us this for centuries. But you know, there's now scientific proof. Seriously, I read recently in a journal that there have been studies by scientists that have shown that if someone smiles, other people smile. If someone yawns, other people yawn. So we're all connected to each other. So I just, again, want to ask you to stay connected to your gut, to your inner wisdom, stay connected to each other, and just as your health center organizations stay connected through your state, regional, and national associations, it's a proven tool of success. You are the caregivers in your community. You don't need permission to care for yourselves. Everybody in this room is worth it. And I feel really blessed to have been affiliated and to be affiliated with all of you. Thank you.